ready?
Sure.
All right, first question. What is your name? What do you do here, and how long have you been working here?
I'm Ryan Delaware. I'm the Behavioral Health Clinical Director, and I've been here since December of last year, so about 9 months.
Anita Cordova, I'm the Chief Advancement Officer, and I am celebrating 16 years this year. Very exciting.
Well, my name is Philip Drexler. I go by Phil. I'm a community health worker, and I've been here about 2 months, approaching 3 months.
My name is Lee Apholter. I'm one of the dentists here at AHCH, and I started in March of this year.
Hola, me llamo Alina y yo he trabajado aquí hace un año ya, ahora en agosto, que estoy trabajando como asistente de estudio de arte aquí en Albuquerque Health Care for the Homeless.
My name is Joseph. I'm a client advocate here in the Resource Center, and I've been here for about a year, although it does feel like I've been here forever.
My name is Angelica Lopez. I am a housing specialist here, and I've been here going on 4 years. You know, I have the passion for it. We need more resources out here, and I'm here to help navigate, you know, our folks to the resources that are throughout the community. You know, help them with housing and just be here to advocate for them.
When I came to social work 12 years ago, I really wanted to work with this population. You know, the homeless community has a lot of aspects to it that brought me to the field. They're a marginalized, underserved, misunderstood population. And I'm working every day with mental illness, substance use, legal issues, housing issues, everything that brought me to the field. So working with the homeless community kind of checks all those boxes for me as a social worker.
I have always been really interested in public health, and that's been consistent since I was in middle school. I grew up in Albuquerque, and I volunteered with a lot of the organizations here in Albuquerque the whole time I was living here. And it just became something that I was super passionate about, particularly working with the homeless. There's so many areas of public health that you can get into, but for some reason, it's just something that I mesh well with.
I chose to work at Albuquerque Health Care for the Homeless when I ran into their outreach team at the domestic violence shelter I was working at the time. Very interesting to see them doing healthcare and quality healthcare in an office in the field. It was really interesting to me, piqued my interest. I love the social justice mission, and working to end homelessness keeps me here every day.
There's a few reasons why I am a community health worker. First, I have an interest in medicine, and those are long-term career goals. So I was looking for anything that put me in contact with patients, and this job definitely does that. The other reason is that we serve a specific population, obviously the homeless, and protecting the vulnerable, those who need help in ways that maybe others don't. That's always of high importance, so it provides a lot of purpose.
Bueno, específicamente el estudio de artes combina dos cosas que me fascinan: arte y también la condición humana. Entonces yo puedo practicar las dos cosas en el mismo lugar, entonces eso me trae mucha felicidad. Y también estoy estudiando educación de arte, entonces yo creo que esto es un buen ambiente para aprender en el mundo real.
I think fundraising is core to the mission. A social justice mission, you have to fund it, and it's core and part of working with donors is what we do, and people love to pay us to do the work we do. I think it's one of the best jobs to do, for sure.
If I can help out one person, that's a good day in my book. You know, I just love working with the team that we have here. So I just be able to come in here and just work with the team. We all have each other's backs. I love being able to give, because growing up, I always had people give to me, so I just want to be able to give back as much as I can.
I find that the work culture in nonprofits is energizing for me. I think you have a lot of people here that bring a lot of compassion to the job, a lot of energy to the job, and that's the kind of team I want to belong to, and the people that I want to work around. Energizes me and keeps me going.
I chose to work with AHCH just because I knew that this organization was passionate about what they did, and so the idea of working with other people who are also passionate about what I'm passionate about, we can work together and really actually make an impact on what we're doing, and that was really important to me, and it feels more fulfilling when you've got other people that kind of have that camaraderie with you.
Yeah, I like this question. I was thinking about this, and I like it because it seems to ask what's something, maybe a wisdom element of working that you've observed or formulated, or it's asking about truth, and at the very least about truth. And it's, to be simple, this is a tough population, so it's hard to sum up as a single, there's these single things that stand out, but I am surprised by the challenge of it. That's one thing, and the thing that's coming out with time is the humanity of literally everyone. And this is one of those things where when you say it, it kind of doesn't have the meaning that you're trying to describe. But really, there's quite a lot that happens here, from providers taking great care of people to clients helping each other with things, to all the resources that are provided across the spectrum of the staff. And I'm humbled to be part of that.
Cuando uno está pensando de personas que no tienen lugar donde quedarse, hay que saber que cada persona tiene algo para enseñarnos. Tienen experiencias y son artistas y músicos y les gustan la historia y saben mucho de idiomas antiguos y algunos tienen mucha educación, entonces siempre hay algo que podemos aprender de las personas, especialmente las personas homeless, porque son algunos de los más interesantes personas que yo he conocido. Yeah. Y con el arte uno puede descubrir esas partes de una persona.
Putting yourself, I guess, in client shoes too. You know, us being here, they come to us for help. You know, we are like their advocate, whether that's with taking a shower here in the resource center, whether that's getting a basic need of an ID. You know, you need an ID for everything. You know, whether it comes to housing, birth certificates, anything of that sort, that helps with everyone that comes to that door, asking questions. Just try to answer from one at a time. And, you know, to people who hear this and listen, you know, just be there for one another and make sure to help each other as much as we can.
For healthcare for the homeless today, something that I think we need to keep in mind about the homeless population is that there's so many areas of their life that someone may be going through struggle. There's concern about where they're able to get food, where they're able to sleep tonight, just day-to-day basic needs. And so because of that, a lot of time their health actually gets put off to the side and they're not able to focus on it. You know, as a dentist, I'm particularly aware of the fact that your teeth, you know, they're at the bottom of the list at that point. So it's something where if we can promote awareness that these needs are not being met, and as an organization step in and provide those resources to them and let them know that there is somebody there that can help them with that problem, that it's not just something that they have to put off to the side, it's something that they can prioritize for themselves. I think that's huge. If at the end of the day I can take one thing off of somebody's plate that they're worried about today, that they don't have a toothache, that they don't have that infection going on, and they're able to focus on other areas of their life, then that's what's really, really important to me at the end of the day. And I know I've done my job.
I think that they should always, keep an open mind of the resources and the struggles that are out there. The system can be really hard to navigate, and so that's why we're here to, help and navigate through the system and give what we can, out here.
So I think it's important that, you know, people that don't necessarily work in the field that I do, I think it's important for them to understand that, you know, there is no cookie cutter approach to people experiencing homelessness. You know, here in Albuquerque, you're looking at thousands of people every night that are unhoused, many of whom don't have a place to go. It's important to recognize that they're all individuals with individual histories, individual backgrounds. It's not some homogenized population where everyone's the same. And, you know, when you're working to help people in that situation who are experiencing homelessness, it's important to recognize that what brought this person to sleeping on the streets may not be the same reasons that someone else is sleeping on the streets. And looking at it from a holistic, whole person and individualized perspective, that's where the most effective treatment comes from.
Healthcare for the Homeless Day is the first day of National Health Center Week, and it is a very important day to recognize the need of healthcare for people experiencing homelessness. And I think what people should recognize today is the chronic depletion of health when people start to experience homelessness. If they aren't sick already, they will become sick and can become sicker and die. Homelessness is it's a public health issue. It's an epidemic, and creating a situation where people are forced to live on the streets without a home deteriorates their health. And I think people should be mindful of that today on Healthcare for the Homeless Day.
Great.